Hi, I'm Dr. Myrna Lazaga here in San Diego. Today we're going to talk about and answer some questions regarding tooth repair for damaged tooth, broken, or cracked or chipped tooth. The most common damaged tooth that a dentist see is cracked, chipped, and broken tooth. And those are that usually comes up, and then that the patient also becomes aware of when it happens, as opposed to um, all of a sudden they don't feel a thing until this year something is broken. There are a lot of causes for a chipped, broken, or damaged teeth. One is decay. So that weakens the tooth. Like, say, for example, the chewing surface, even though it's just a pinpoint decay, it can get bigger on the inside. The other one is there are cases when you have what we call hypocalcification on the teeth. They tend to be softer. You can see that with teeth that has kind of like whitish on it. What it means is there's not enough calcium deposited in that area, and it's softer than the healthy teeth, and that can easily get decayed as well. Also, you can crack a tooth by biting on something hard. I've seen a lot of cases wherein even those fruit seeds like guava that can crack a tooth all through from the top all the way to the roots. Also, when you have, like, say, for example, you fall down and you hit your face somewhere, and there are some cases as well. I highly recommend kids or folks that are involved in sports to wear mouth guard. When someone has chipped or broken tooth, the only recommendation is for that I would say is do not bite on it at this time, and but go to the dentist as soon as possible to have it checked before it can get more worse. That's when it's taking when a tooth is already out from the mouth. There are a lot treatment option for a chipped tooth. It depends how big is the chip. If the chip is like small enough that we can put a filling, or we can do a veneer, or if the chip is big enough that there's not much tooth structure left, then we definitely go for a full crown. A dentist would recommend a crown for a chipped tooth. Like I said, it will be when there's a lot of tooth structure that's already broken or chipped or fractured, and there's not much tooth structure left to hold a filling. So I highly recommend a crown on in that case. When there's missing also cusp on a tooth, let's say for example, we call it bicuspid or premolar. There's like two cusp on it. When one of those is already missing, definitely you need a crown, because most of it is like half of the crown of the tooth is gone. Definitely you're gonna need a cracked molar can be fixed by a crown. It depends on how is it cracked. Does it involve the nerve? If that involves the nerve, then you will need to have a root canal done first before we put in a crown. Unfortunately, I don't see those home kit or temporary repair kit that's available in the market that would help. I do not recommend it. I would definitely highly recommend for them to see a dentist as soon as possible, because I don't see in the market that those kits that are helpful at all. There's one symptoms that is that will indicate a serious issue with a cracked tooth is one, First, when they bite down, does it hurt? You definitely need to have a crown done on it. The other thing is when you bite down, does it initiate any pain? That also might involve the nerve in that scenario. So those are the things. And also when they have sensitivity on that tooth. As long as it involves any pain, it doesn't matter the level of it. That has to be checked right away. It is possible to crack a tooth in half with no pain. The reason behind it is the tooth uh, probably had a root canal done on it, so the tooth is pretty much dead. Or the tooth had trauma, and then eventually the tooth died and was not able to recover from that trauma, and the tooth eventually was already dead when it cracked, and you won't have pain on that even if you cracked it. Tooth that is badly broken can be noticed when that it's not savable anymore is when they crack it, that it involves the roots already, or when the dentist do an examination that there is a decay on the roots, and that also if there is too much infection, that the x-ray shows that cannot be um, drain anymore by just doing a root canal. So basically, that tooth is not salvageable. And also, another thing is when there is also mobility, that's not savable anymore. Only when it's broken down, when the tooth is still salvageable. But if that the tooth is not salvageable because it involves the root anymore already, then also if the tooth is compromised by gum infection, cannot be saved anymore. Definitely need an extraction. You can also save a tooth that's cracked by doing what we call crown lengthening, wherein you enough to be able to put in a crown. But if it's not it involves already the roots, and it only the nice thing about it is that the dentist will be able to tell if the tooth is savable or not. I don't know of anything that is helpful, the home kit repair, and I don't recommend them, but I highly recommend to see a dentist right away, and our office would gladly get you in for a free consultation. There are some cases when that I've seen in my office wherein a patient a crown came off. He tried to use those kits that they get it on the store, and so he tried to put it back, but he was not able to put it correctly, so his bite was off. Like the rest of the teeth is not touching, only that crown. Then I have to end up taking the crown out and give him a new crown. So that becomes more expensive. Whereas if he could just have come to the office, I may be able to re-cement that crown back for him instead. But of course, that's why it's better to have it checked by the dentist instead of do it yourself. Again, this is Dr. Myrna Lazaga. Please call our office at 619-477-0570 if you have questions regarding a broken tooth, and we'll be happy to give you a free consultation. Thank you.